So when we're looking at the administration of a traditional assessment between a neuropsychologist or clinician and a patient, there's a decent amount of interaction that ends up happening between the two. So a neuropsychologist will help guide the patient through the assessment, will be speaking to them. The patient will also sometimes, in addition to completing the task, for example, if it's a memory task listing out words, they'll also add in interjections in stating how they're thinking about the task. And so all of these interjections are things that a clinician will typically note, and in their final diagnosis after looking at the entire battery will include observations about that in their final diagnosis. And so what we want to do with the acoustic metrics is actually capture these aspects and subtle things that clinicians are already noticing. So we can approach acoustic metrics from two different sides. The first is the motor aspect of it, and so that's looking at an individual's speech production and the muscles that are involved in producing the final amount of speech. So there's been a decent amount of literature that's looked at how there's reduced loudness of speech as well as reduced vocal quality of speech in individuals who have cognitive impairment. And so that perhaps is just due to impaired motor control during a task because individuals are thinking really deeply about the task and having a difficult time with the task. So that motor aspect is something that we want to enable within these acoustic metrics, and we can capture with different signal processing techniques. The second side of things that we're looking with acoustic metrics is more with regards to timing and rate of how individuals are speaking. So we've seen in, again, literature that differences in reaction time, time to start the task, pauses in between different words within the task, as well as the rate of how quickly people are speaking is different between cognitively unimpaired and cognitively impaired. So if we're able to capture those through, again, signal processing techniques as well as processing of the language, we're capturing a little bit more about how the patients are thinking about that. So altogether, combining the motor aspect with these pause-based and timing-based metrics and language aspects of the task itself, we're able to form a more complete picture that can augment the score and understand not just what the patient is saying, but also how they're saying it within the assessment itself. When we are implementing any process-based metric within the clinic, we want to be very careful that it's not just adding an additional data point that clinicians need to look at, but rather it's augmenting their existing workflow, or potentially as an endpoint in a clinical trial, that it's going to show some signal as patients are going through the trial. So the first thing that we want to make sure that we're looking at is interpretability, validation, and accessibility of these metrics. The interpretability aspect will come through going through literature, talking to clinicians, really understanding what it is of these extra items that patients are showing them, the signals that are subtle but do indicate additional thought processes that patients are going through while completing these tasks, and then validating them through frameworks like the V3 framework that's been put together by DIME, and making sure that we have both the verification of the metric itself as well as analytical and clinical validation to make sure that it's fitting into the existing clinical workflow, but also augmenting and showing additional signal past what we already see with the traditional assessments. And then finally, the accessibility of displaying all of these process metrics or combinations of process metrics in a format that can be used by both the clinician as well as the patient so that they can better understand their brain health and really tell a complete story of what's going on in the brain. One of the other challenges is from the technical side of things. So as we all know, speech is a very complicated thing, conversations are very complicated, and so when we're trying to use automatic scoring tools like automatic speech recognition tools or speaker diarization tools to separate out the clinician and the patient's speech, they've been tuned for more general frameworks, but not necessarily the in-clinic or remote capture tool. So this requires us to go through and do pre-processing of the audio to make sure that we're getting rid of any noise or distractions that may have occurred within the audio, but also fine-tuning existing ASR models or large language models to be able to make sure that we're capturing the right amount of speech and that all of the metrics are accurate. And then this also stems into another challenge between the accessibility of digital tools allows for remote collection as well. So it's not just about capturing this within the clinic, but also can the patient take this home and actually complete it longitudinally so that we get more fine-grained analysis of their brain health. but we want to ensure that there's actual parity between the in-clinic aspect and the remote aspect. And so once again, this requires observation of the clinician and really understanding what is it that they do when they're guiding patients through the tools. The process metrics themselves can be extracted from a signal, but we want to make sure that the actual assessment that's collected mirrors what's seen within the clinic. And so that's creating that entire ecosystem and data collection platform that can mirror the in-clinic experience within the remote, but also making sure that we're accounting for things like demographics, age, sex, ethnicity, language differences that may occur as well, so that the assessment is valid across all of those contexts. And creating something essentially kind of like a clinical trial to be able to compare parity between the remote and in-clinic metrics in both healthy and impaired populations. And so altogether, we're ensuring that we're creating this larger ecosystem that can then support the accuracy of the process metrics to help patients really understand their brain health and the story that it's telling.